Sioux Lookout First Nations Health Authority, or SLFNHA, presents SLFNHA Radio Connect, building strong connections with communities by sharing who we are, how we can help, and the services we offer. Wiindamekewinan, Sioux Lookout First Nations Health Authority Gajgadig, Egochke Eskam SLFNHA Ijankade. Miwa Kegunenan Iwanun Keguns Wichi Guyagban Ima Ishkunaganang Kazgabeshig, Egochke Iwanun SLFNHA Wiindamekewinan. Greetings. My name is Charles Mikas, and I will be your host today. I currently work in the Wiindamekewinan department at Sioux Lookout First Nation Health Authority. And I'm originally from Sandy Lake First Nation. I've been with the organization now for about 8 years. Bojo waje gidna hegama ngagaku gajmawe ogama kegunenan iwenun akuzi mujgaunan imanike Sioux Lookout First Nations Health Authority. Welcome to today's program. We are honored to have with us Sonia Isaac-Mann, President and Chief Executive Officer of the Sioux Lookout First Nations Health Authority, or SLFNHA. Today we will be discussing SLFNHA's role, the services it provides, and how it supports First Nation communities. Welcome, Sonia. Bojo gidniguna iwe gawita dajindamag noom gagijik. Maaj miigwachindana ima gawi dajindang anine nankhuyaj. Sonia Isaac-Mann ijinkaz. Miawi gaw ugamawi biokhandang iwe Sioux Lookout First Nations Health Authority gajgadik. Eskam gaya SLFNHA ijinkade. Miwanun gawita dajindang noom anin meame nankhuyaj. Anin meame nankhuyaj egotskaya. Anin kegiz wichin daban ishkuniganang gawtsiwaj anshinwag gananaga chinda ima Northern Clinic gajgadig nanditske ima hostel. Bojo and Dinaman, how is Sonia?
Miigwech. I'm happy to be here to share more about SLFNHA's work.
Miigwech. Mawadamine danhwa epijan. Kabitibenda Wiindamekewinan Sioux Lookout First Nations Health Authority Wiindamekewinan.
To start, can you tell us a little bit about SLFNHA and who it serves? Miwa kamajstuyak gadaw Wiindamekewinan anin meame nankhuyajaunog Sioux Lookout First Nation Health Authority. Egotske awaninan eyantko awaj.
Great, thank you, Charles. So SLFNHA serves 33 First Nation communities in the Sioux Lookout region of northwestern Ontario, covering Treaty 3, Treaty 5, and Treaty 9 territories. The need for a community-driven health system was recognized decades ago, following key events that shaped its creation. In 1988, the Sandy Lake First Nation hunger strike and the Scott McKay-Bain report highlighted urgent health disparities in First Nations communities. These events led to a unified community direction to establish a regional health authority, and in 1990, the Sioux Lookout First Nations Health Authority was created. Today, we continue this mission by strengthening First Nations health services and ensuring communities have a strong voice in their healthcare system.
Sioux Lookout First Nations Health Authority Wiindamekewinan sumdanase neshuzab anshinon with the Wiindamekewinan is giwed nunk with neke gaya Treaty 3, Treaty 5, egotske Treaty 9 akin. Egodashima gchinun deseun bin akuziwi chuan giwjins donagade mshinomidashya danank. Michima 1988 engozagani winwag winchidagi kawakadzawa hidok. Egodashima Scott McKay-Bain the Badgemon up in Huagapistu Padna Quandakudakuzi Chigonoa Kistbadude. Egodasuin one is Jigaunan, me Mapagagan to Nastigade Akuzi Chiwewan Wedneke Kamik in my 1990 Sioux Lookout First Nations Health Authority up in Given Nastigade. Nongom the Skagis Gag Miwe Gabages Mankadamank. Jenna Maskawatenik and Sin Udakuzi Wichigon. Egomina Gestinat Abonak, Chimaskawanak, Kaganoj Getamoatamwach, Udakuzi Wichigonoa.
That is a powerful mission. Can you tell us what kind of governance structure does SLFNHA have? Maju Kchinandawaniwe and Huan Gab Mujgadik. Gadawin the Mosnamna Bangi Anin Eseg Anin Tujgadik Gegun Gaun and Jgadek.
Great, thanks, Charles. So SLFNHA operates with the guidance from two key governing bodies, the first being the Chiefs Council on Health, which was established in 2004. It provides political direction, advocacy, and oversight. It ensures that First Nations have self-determination over the regional health system. The second is the Sioux First Nations Health Authority Board of Directors, which includes representatives from tribal councils and the independent First Nations, as well as two elders. They help set the strategic direction and ensure governance follows both Anishinaabe teachings and corporate structures. As the president and CEO, I am accountable to the board and responsible for implementing our strategic plan and ensuring that SLFNHA operates effectively.
Ni soye guntuwicha Sioux First Nations Health Authority gab motigates. Chiefs Council on Health given 2004 and shiniwe ogima wonje dakwahiget ekanoz getamaget mina wonje kanawentiget getsinat and shin win chiangan udang udakuzi wichigon. Sioux First Nations Health Authority Wiindamekewinan unjiwak tribal councils minagaba base go board and shinwak kaye nisen kchihak Udona tonawa keni suwitikana wanik mina kitchinat and shiniwe ukumahkank chiwanchimakanik Wiindamekewinan mina wemstgosiwe unatsigewen abatstaganan. Niintaskasu ukemawian nentonse wiidankimak udabistamagek. Mina nebabamzikandan chiane totsigatek natsigewenan. Mina ke getsinat Sioux First Nation Health Authority chiminsenik opmotigewen.
You mentioned SLFNHA's strategic directions. Can you share more about how they guide your work and what the key focus areas are? Miwagigi anmudan gaunakunagadeg anin gegij anis mujgadeg bananhuun. Kadawin demosnam na bangi kegunenan iwenun. Kegunenan mawajek chinendaukan iwe anhuun gab mujgadeg.
Yes, our 2022-2027 strategic plan focuses on three key areas. The first being community ownership. It's focused on determining community-based healthcare needs and aspirations and developing long-term community relationships. The second is health transformation, which is focused on Anishinaabe control and authority to develop and enhance services guided by Anishinaabe ways of knowing. And lastly, service experience, which focused on supporting community members to provide operational feedback to the organization for continuous improvement. SLFNHA's current strategic directions will evolve into the next strategic plan, which we will be looking at refreshing this fall, 2025. Ongoing community engagement efforts will help shape the next cycle, ensuring services reflect First Nations' evolving health needs.
2022-2027. Wiindamekewinan nissen kegunan uganawabandanan. Abuwan tibenchigewan. Chunentaman kidahkusiwan on desewan. Mina ke kagwedebinagategan. Mina wasanigan chisian kadeg Wiindamekewinan. Chianchigade gakusi wichiwewan. Anishanana chitibentang mina chogamahkandang chi ane onatoch udanshniuk kendama udashtia batstoch. Wichiwewan kendamawan. Chiwich hindo anshenwag chitibatu damuach esenik udakusi wichigonoa. Awashme mosag tiane mensenik. Sioux First Nation Health Authority nongum gaishuwichigech da anishamagan apin minawach kutak unahtikewinan. Wian sagakbihigade no kom kenitagwagan. Kiwigayang an sinikang nagawichi gomen geni se unahtikeang minawach. Gechinat wichi wewen chimin sewach an sininwak.
Let us shift to the services that SLFNHA provides. Can you help us through the different areas of support available to communities? Egama iwenun gedawin de mosnamna anin mayam is bumujgade yue akwaziwan kuan ahing SLFNHA gajgadik gedawin de mosnamna kegunenan iwenun hayagin awya ishkunaganung kayaj kawi kaweded juichihins.
Great. SLFNHA provides a wide range of health services, client support, and administrative programs. The first area is health services. We have several program areas. Approaches to community well-being focuses on community-wide health, illness prevention, and health promotion. Noden Mental Health Services provides counseling support and intervention for children, youth, adults, and families. The primary care team is a mobile team that brings primary health care to communities. The diabetes program, developmental services, and cancer screening programs help address chronic disease management, child development, and preventive care. In client services, we have hostels and accommodations. We currently operate 3 hostels in Sioux Lookout, offering a safe and welcoming space for clients traveling for medical appointments. Transportation services, we help clients get to their medical appointments and pharmacy trips. Meals, Michim program, clients receive 3 meals a day, including traditional food options. And client advocacy and patient navigators assist clients in navigating health services and medical travel. We also have administration as part of the organization, so we have a strategic policy, planning, and quality team that focuses on community engagement, research, quality assurance, and privacy. And then we also have people and culture, finance, IT, communications, and training that ensure SLFNHA has the skilled workforce and strong infrastructure that it needs to deliver service.
Sioux Lookout First Nations Health Authority Mishinoyeganene Wiindamekewinan. Utakosi Wiindamekewinan mina masnaikeshish anukiwanan. Akosi Wiindamekewinan. Apewan menuyawan. Uganawabandan kakna awian chimenuyanich. Akosi unen chi kanchigewan mina menuyawan ng chisi anukinanawang. Noten umamit ni chigan Wiindamekewinan. Ma mina muwewak mina Wiindamekewinan apnojishan uskatasan. Kaki siganich kaye tibenchigewanan. Kani waj maskakiwi anukinaganak opito nawa mistahi minuyayawanin apuwanak. Sugawa pinewan Wiindamekewinan. Mahkasiyo Wiindamekewinan mina piwab ko man Joshua pinewan. Nanagatawen muewan Wiindamekewinan nepidapiniwanang. Mahkia bino Jesus Wiindamekewinan mina chitutang egagesi ahkusit. Ahkusi Wiindamekewinan. Kabeshi ugamagon mina Wiindamekewinan. Nipimo utomen nasan kabeshi ugamagon. Wananawang kang kesimeno kabeshi wach utahkusik. Isdabana wewen. Jisuwanan toa utahkusik maskakiunan nihkang mina chinachi maskakiwewach. Ashangewen. Neswa asamawa kaye natumichimene. Ahkusiwe kanojikehtamakewen mina utahkusiwe tahkwahikek. Niwiti hamen utahkusik antikese naz kamwat Wiindamekewinan mina pimsewanan. Umas naigesis pimutsigewan. Ka unenchigatek mawaj kese minsek unachgewen, unachkunegewnes. Unachgewen mina ka nagachtuach utankiwenwa mihawenwag apuwen ka jawach. Unanagachtu unanagatawin chigek kechnach kakina ke gonchiminsek mina ega chiwistaji kawinch. Awiyak mina inatasuwin. Sonia Biwabik kakanonatuwin mina kiknohamagewen kechnach Sioux First Nations Health Authority Chintawanukinich utankinaganan mina chimashkawatenik udabachstaganan.
It sounds like SLFNHA is working on all fronts to support communities. I also understand that SLFNHA integrates traditions and culture from communities into its programs. Can you speak more about that? Egowenun Ankunan ga bumujgadegen ahing SLFNHA maaje kedwaj wichi hawaj ishkun ganang gayawaj anchinwage go anchinabek. Gedawin de mosnamna kegunenan yuenun anchinniu gegunan ka ankunan ga bumujgadegen anin is abats tradegen yuenun anchinniu an suge anchinabel kendamonan gedawin de mosnamna.
We recognize that cultural identity is an essential part of health and well-being. That is why we have the Anishinaabe Wadiziwin Department. This department ensures that our work is guided by traditional values, protocols, and teachings. Some of the core principles include compassionate care, working together, and good health. One of the newest initiatives is Anamanzibi, a beautiful camp with 8 cabins that opened in 2022. The traditional healing program runs out of the camp and offers services and supports. Located along the scenic Vermilion River, it serves as a space for both client and staff retreats. The camp can also be rented out by other organizations looking for a setting that supports wellness, cultural learning, and land-based healing.
Ninisdawanamend, inatasiwag ken mituwin, mawat kchine dagwan, minuyayawanang. Mihuwe anshnabewata suwan kagi unche unatuyank. Wahawe anukinagan udonche wichikun. Anshnabe okanaten chigewanan. Bemata siwe tutamowanan. Mina kiknohamagewanan. Andaga niganen chgadegan. Kanawen muwewan. Wiindamekewinan, mina menuyawan. Mawat uski abatstagan, onaman sibi, kabeshuan en soswakahiganea kipahkanagade 2022. Anishinaabe kigehiwewan abatan, mina wijihiwewanan, mina asuskagagewanan. Vermilion River hima isyate. Otakusik mina anukinaganak ukagiabatstunawa. Kabeshiwa kamekon kaye pahkan awya udagi abatstun. Ka pagusentang pehtaging. Inatasiwan na wikkendank mina.
This has been such an informative discussion. It seems SLFNHA is making a real impact in strengthening health services for First Nations. Before we wrap up, can you share some of the latest updates and what is coming next? Majugo Kchinendawan Majugo Munendawan Yue Kegunan Gagista Dejendaman Anin Ankyun is Mujgade Gahing SLFNHA. Egotskia maje kedwaj chigi wichi hawaj awenug ishkunagan gayawaj. Ega minugmage gizipsig kedaw in the mosnamna anin kegunenan epian kwadegen Gazibak
Some key initiatives on the horizon include health hub openings. So currently we have 6 different communities with health hubs that are operating, and 2 more opening later this year. You can find all of the community health hub information at SLFNHA.com. We also have a 2025 Special Chiefs and Elders meeting that will be happening July 8th and 9th in Sioux. Leaders and knowledge keepers will gather to discuss health priorities and community-driven solutions. The annual Spring Chiefs Report will be shared soon, and it reports on SLFNHA's strategic directions. Chiefs can expect high-level updates ahead of the annual report, as well as the AGM, or the annual general meeting, this fall that's happening in September. It provides ways to give feedback through their board or CCOH representatives, or by contacting me directly. Strengthening partnerships and relationships remains a key focus. I have visited several communities and always welcome invitations to learn about your health priorities and work together on solutions. The SLFNHA board is strengthening its governance through training, clearer roles, and updated policies, while balancing our values with the responsibilities of a corporate structure. And we also have a new strategic policy planning and quality team that's been developed to support alignment across the organization and help bring our strategic plan to life. This team supports community engagement, policy planning, reporting, research, data, and quality, and provides technical support to the Chiefs, the Chiefs Council on Health, our board, and directly to myself.
Thank you, Sonia, for sharing these insights and for the incredible work you and your team are doing at SLFNHA. Miwa maudzugo kchimigo etskidnugo Sonia. Iwanun gagista dezindaman Akwazio Anquion Gab Mujgadig Ahing SLFNHA maudzugo miigwech Dinag Awanug Gawidan Kumada. Miwa miigwech.
Miigwech, Charles. It's been great, and it's been a pleasure to be here.
Miigwech. Mawat kchine dagon egwa mawat nemnedan uma eyayan.
So that concludes today's show. Thank you for tuning in to SLFNHA Radio Connect, where we are building strong connections with communities by sharing who we are, how we can help, and the services we offer. Connect with SLFNHA on our Facebook page or on our website at www.slfna.com. Miapanugiwa etibseg noom imaga Wiindamekewinan Akwazio Anquion Gabmujgadig ima SLFNHA Radio Connect. Mawadjugu aikadnanun isunganan zuidan huimunda anshinwagega anshinabeg egotske anin gegizwichigu emban iwa Akwazio Anquion Gabmujgadig miwa miwach.
Recorded and produced with Wawate Radio, Wawate Communications Society.